Vanessa, as I like to call you, V, as we like to call you, V. Okay. Well, thanks for doing this with me. As you know, talking about quality improvement in infection control is one of my passions. So I'm glad you were willing to do this with me. So I'm really glad we can do this. So before we start, can you just briefly introduce yourself?
Sure. My name is Vanessa Makarewicz. I am the Director for Infection Prevention and Control at Harborview Medical Center. I have been with UW Medicine for 19 years now, and in infection prevention for about 15 of those 19, more or less. My background is I am a nurse. I was a medical surgical nurse on a telemetry transplant floor, and then got my master's as an infectious disease clinical nurse specialist through the University of Washington program. And then dabbled in some CNS work along the lines of central line prevention, um, and then came to Harborview in 2013 as their program operations manager and really worked as like a CNS to operationalize the infection control initiatives. And then worked my way up into management and then up into the director position.
So you what we can call an infection control operations master at this point.
Yes, that's probably all I know to do is how to operationalize
To
things. But
operate.
yes, I'm
So
very good at that. Yes.
you like the mechanic of infection control. Yeah, perfect.
We do
Yeah.
love, I mean, it's great to be a subject matter expert in
Mm.
infectious diseases. However, I feel that my strength really comes in programmatic um, themes and operationalizing a program. I have a lot of, we have a great team. I know that's a question coming up, so I'm just going to answer it now. We have a team of 4 infection preventionists um, that all specialize in certain aspects of the program. So each IPC program is set up differently, but the way we have it in our institution is that an IP is really identified a subject matter expert for each kind of initiative. So we have
Mm.
one IP that's working on MDROs, and so that's like C. diff and MRSA, but also outbreaks and surveillance and things like that. We have another IP that's working on central line infections, and hopefully will kind of encompass all device infections at some point in the future with CAUTI and VAEs. And then we have another infection preventionist working on um, facilities and also water management. So, a lot to do with the environmental aspects of infection control. And our fourth IP works on just doing overall surveillance for our program. So we took surveillance out of our SMEs into just one person. That's all they do is the data day in and day out. And that was probably one of the best decisions we could have made in a program that is extremely busy. We always have
Mm.
a consistent data that's always due and always done and on time
Yeah.
and very thorough and
Yeah.
um, very well done. And then you're going to be asking, well, what about surgical sites and all these other little things? A lot of that then kind of falls into my lap right now until hopefully we get resourced again for some
Yeah.
FTE, but that's not coming anytime soon. But we really are pushing this year on our surgical services team to lead SSI prevention and kind of really take ownership of that, where a lot of times those initiatives for SSIs have grown from infection prevention. We know that those initiatives are never totally sustainable within kind of overall surgical services. So we're really putting the onus on surgical services to do the work with us as consultants. So that comes up, and then whatever else happens, we kind of divvy up depending on people's interests. We also do have part of our team. We do have 3 infection prevention operation nurses. And this is somewhat of a new role that I am going to publish this year about, because it's a great new role that we made, in
Okay.
which these nurses are really the charge nurses of infection prevention 7 days a week during business hours. They're doing our daily tasks, such as ensuring that people coming into our system are in appropriate precautions. They are taking our pager and answering the questions. They're looking at patients for clearance. Ideally, we would want this on the onus of the people at the bedside. But
Yeah.
at this current time, and especially coming out of the pandemic, people just don't have the capacity to know our policies and protocols as exact as we do. And there's a
Yeah.
lot of new staff, a lot of new nurses out there, a lot of new physicians. And so we provide that safety net through these nurses, which has been phenomenal. And it's also helped with our census and our patient flow. So I think has really been a really innovative role added to
Yeah.
our team.
Yeah.
And then two other folks I'll just mention too. We also added a clinical nurse educator to our team that would also help support the IPs and their initiatives around HAIs. But our educator has taken on a life of its own,
Yeah.
leading our hand hygiene program, really doing a lot of education of getting people back to basics around infection control, re-engaging the bedside, and really being a huge support to our team, in which we were all expected to be educators, but they're trained to be an educator. They know how to educate and are moving forward, which is really, really great. Excuse me. And then we also have our sepsis coordinator that's in our team as well.
Yeah.
And they used to live in a different department, have been integrated into ours, and it's been phenomenal because there's so many different bridges and connections and silos breaking down because of them being within our department. So we have a big team